Hi there, I'm Dr. Bridget Norton. You can call me Bridget. This is Menopause Bites, where I unravel the mysteries of menopause for you in bite-sized episodes. Today, let's talk compounded hormones and why we don't recommend them. The idea that compounded hormones are the perfect solution to perimenopausal and menopausal issues and that they are uniquely tailored for you is a serious misconception. The idea that testing your hormone levels can lead to a personalized blend of hormones that will make you feel your best is unfortunately just not true. There are numerous issues with this idea, including the belief that hormone levels directly correspond to your symptoms. They don't. Or the idea that we know the precise hormone levels required to feel great. We also don't know that. Also, attributing all of the challenges and problems experienced in midlife solely to hormones being low or out of whack is misguided. You can't ignore the impact of over 50 years of wear and tear on your body, the various stresses in your life, your genetics, other illnesses you might have that might be causing issues, the medications you are taking and their potential side effects, and so on. I had someone actually ask me the other day if her toe fungus was related to menopause and whether hormones might help. Just in case you're not sure, it's not, and it won't. Another misconception is that custom compounded hormones are safer. In reality, they may be more dangerous because they are not regulated by the FDA. None of the major OB/GYN organizations, or frankly any medical organization, recommends compounded products. And the primary reason is the lack of quality control and oversight to ensure the products are safe and reliable. Now, compounding pharmacies do get their hormones from the same pharmaceutical companies that supply FDA-approved products. If you think a compounding pharmacy has a vegetable patch out the back where they are harvesting edamame and yams to make their hormone products, you better think again. Bioidentical hormones are actually plant-sourced, but have to be chemically modified to be effective. Yams and edamame don't actually contain female hormones. They contain a chemical that is similar to hormones that has to be modified in a lab. If those plants were really good sources of estrogen and progesterone, we could both be snacking on them right now when we wouldn't be having menopausal symptoms or need hormones. But we can't do that because plants don't actually contain human hormones. So while the initial product used by compounding pharmacies is pharmaceutical grade, the FDA doesn't actually regulate compounding pharmacies themselves or the products that they produce. So you can't be sure what you're getting when you use these products. You don't know if you're receiving the correct dose, whether the active ingredients are being absorbed properly, or if they're providing consistent hormone levels where you actually need them. Many studies show that each time you fill a prescription at a compounding pharmacy, you might be getting a slightly different product each time. A good example of the problems with compounded products is bioidentical progesterone cream. In menopausal hormone therapy, you need progesterone to protect the uterus, as estrogen alone increases the risk of uterine cancer. However, bioidentical progesterone is too large a molecule to be well and predictably absorbed through the skin. If bioidentical progesterone was effectively absorbed through the skin, there would be an FDA-approved bioidentical combination patch available. But there isn't because it simply doesn't work. So that means when you use a progesterone cream, there is no guarantee that you're getting the necessary protection for the uterus, potentially increasing your risk of uterine cancer. Don't use a progesterone cream. It's an expensive and potentially dangerous moisturizer. Another thing to avoid like the plague, hormone pellets. These tiny pellets, about the size of a grain of rice, are inserted under the skin to supposedly provide a slow and steady release of hormones as they dissolve. Pellets might sound like a really convenient solution, but they are not a good solution at all. In fact, pellets can be dangerous. Hormone pellets are also not regulated by the FDA, and I have repeatedly seen that the hormone levels they release can be dangerously high. And once they're inserted, there's no way to remove them. I have seen women who have pellets in place with precancerous conditions as well as uterine cancer, women with enlarged clitorises resembling mini penises, women whose voices have become deeper, all due to excessively high hormone levels from the pellets. If you take anything away today, it's this: never get hormone pellets. Now, as I already said, many women are seeking out compounded hormones to achieve a mythical perfect balance of hormones. However, there's no such thing. There is no correlation between hormone levels and symptoms. Two women can have exactly the same hormone level, one having terrible hot flashes and one not having any at all. Rather, ideal hormone therapy is the one that effectively treats your menopausal symptoms, but in a safe and predictable manner. That's why we recommend using FDA-approved, safe, and well-studied hormones, and our first choice is bioidentical hormones. Instead of relying on hormone testing, we start with standard dosing proven in large studies to relieve symptoms in 80% of women. Our focus is always on treating symptoms, not on treating numbers that don't actually mean anything. So, that's it for another episode of Menopause Bites. Here are some take-home bites to remember. No medical organization recommends compounded hormones due to serious safety concerns and lack of FDA regulation. The FDA has safe and reliable hormone products to treat menopausal symptoms, and we prefer the bioidentical options. And lastly, progesterone cream is an expensive moisturizer, and hormone pellets are dangerous. Until next time, may your hot flashes be bearable, your nights restful, and may your train of thought never derail.